Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. I want to be able to give you guys the basic scenarios that you're going to face. When you walk in to a nursing home, a skilled nursing facility, there's going to be probably a really small reception area, and sometimes there's not even a reception area. But you're going to have the front desk, you're going to have that little booth or something, or the little open window. And you're going to have somebody there. That's what we call the gatekeeper. That's the person that's answering the phone calls. That's the person you need to be able to go past them. And if you listen to what we trained you guys with the cold calling techniques, and hopefully by now you actually watched the cold calling training as well that we provided you guys. We gave you guys for free. It's an hour and a half worth of training on cold calling. The cold walk-in is an important part. When you're walking into this place, you want to be able to, number one, not slouch when you walk in. The moment that you walk in, you should have this purpose. Your purpose is to go after that gatekeeper and get that person to get the person in the back, right? So what we would do is I would go in and I'm like, hi, what's your name? Instead of me saying, hi, my name is Michael, I'm going to ask the person, hey, what's your name? Right? That right there shows authority, right? When I walk in, I'm like, hey, what's your name? And then they'll say, well, I'm John. Hey, John, my name is Michael. Can I speak to, let's say that the person who wants to speak to is Tim, the social worker, right? Can I speak to Tim? Is he around? Is he busy right now? And right there again, if you remember the training a little bit that we talked about in the cold call, I'm just going to use the first name, and I'm going to make it seem like I know Tim, okay? And the goal there is to go past that. Now, if you're going to an assisted living facility, it's the same exact thing. More likely in assisted living facilities, there's going to be a lobby. Then you're also going to have the desk as well, right? Because in an assisted living facility, it has the feel of a person's home. In the hospitals, this right there can be very tough because typically in hospital settings, there's a lot of times people are not allowed to solicit, right? And you are technically soliciting, okay? So the goal here is to be able to speak to them. And once again, you're going to go to front office. You want to be able to find out what are the rules to be able to talk to them, right? Because some hospitals may let you just walk upstairs or walk downstairs to meet with a social worker, and some hospitals may stop you in your tracks and not allow you. But here's the thing. Once again, just like any cold calls, your goal is to be able to get to the next step. Get them to give you some information, a business card, an email, a phone number. When's a good time to come in? Maybe you can get the person on the phone, right? These are little techniques that you need to be able to have. You have to understand the gatekeeper's job is to prevent you. And the truth is this, the easy gatekeepers, the one I can convince really fast to get me to talk to the person, those kind of scare me a little bit, right? And the reason for that is the harder it is to actually get through a gatekeeper, the more trained professional a gatekeeper is, that means more likely it's a lot easier to close the person that you're trying to get a hold of. It's just one of those psychological things because they're so easy to close that they need a good gatekeeper to prevent people from talking to them. So that's kind of the mindset I put myself in. If I ever really have a hard gatekeeper, I'm like, all right, this is, I'm going to do everything I can get to pass this person, because I know if I get past this person and I do everything to get past him or her, I'm able to close this deal even better. So it's a psychological game. You have to put a little bit of a gamification into your marketing. Make it a game, make it fun. Don't make it one of those things where it's just a sad thing if you're not able to speak to the person. You have to be able to say, what are the small wins that I can accomplish day by day, week by week, hour by hour, visit by visit to be able to close this deal and start getting referrals. Okay, so once again, you have to be able to come in and knowing what your purpose is. You must be able to handle the objections. You're going to face a lot of objections, and we're going to go through a bunch of objection training. And just to add it for you guys is we have a full objection training program available, and we're going to make it easy for you to be able to access those as well, because you must handle objections. You're going to start getting objections from making the cold calls. The person's not busy, the person's not in. You're going to get objections when you're doing a qualification, when you do your initial walk-in. They're going to be like they're busy, they don't speak to people, there's no solicitation. I'll give you an example. I've gotten a lot of those comments where somebody will tell me, Michael, hey, I'm glad you stopped by, but guess what? There's no solicitation allowed in this facility. And I'm saying, I truly agree, solicitation is a bad thing, and no one should be soliciting at all. But since I'm here, can I speak to John? And it's me acknowledging their objection, right? So never say no or never be negative against a person's objection, but you need to first recognize it, but then you need to go past it, right? You're going to face a lot of these objections. They're not available. He's not in, right? If somebody says, well, he's not in right now. Hey, perfectly fine. I know he's a busy person and he's not in. Other than the fact that he's not in, is there a good time to be able to reach with him? Remember, once again, every step, if we can go from prospecting, we want to handle any objections, get past it, and get some gain in information. I'm walking in now. I'm doing a cold walk-in. Brought to you by our partners at HomeCareAnsweringService.com and MedicationReminderProgram.com. So MedicationReminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, HomeCareAnsweringService.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have HomeCareAnsweringService.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time, at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.